Hi, it's your favorite Pikin-doctor. So, I'm sorry I've not given you guys update today because my day has been really busy. But however, today I want to tell you about the do's and don'ts for a child that have cholera disease. So, cholera is a very serious illness, especially in children. It has to do with a child having severe acute watery diarrhea characterized by rice kind of rice water stool, and it's usually much, and that can cause dehydration, low sugar, and even make that child to go into coma. So it's not something you joke about. So one of the things you have to do for that child, if you notice that your child is stooling and the poo is like rice water or is very very watery, sipping out of the diaper, one of the things you should do for that child is, please, my mommies and daddies or whoever the caregiver is, go and get ORS and start giving to that child first, or make salt and sugar solution sharp and start giving to that child. I've talked about ORS and salt and sugar solution in my acute watery diarrhea video, so go and watch the video. I even talked about the dose, how you should prepare it, and the quantity you should give. Get zinc tablet and start giving, and rush that child. I did not say take, I say rush the child to the nearest hospital, because if you don't take that child to the hospital, that child will start conversing. That child might even go into coma right before you. The child can go into what we call shock. You can't feel the pulses, and death can result. So take that child to the nearest hospital. This thing I'm just telling you, the first aid you can do as you're preparing to go to the hospital. This is not the kind of sickness as a woman you'll be saying you're waiting for your husband to come back or before you take the child to the hospital. If not, before that your husband reach house, that pikin don't buy. I'm sorry to tell you, but that's the truth. So another thing that you can do for that your baby is ensure that you're feeding that baby, because I told you that one of the things that can happen to them is hypoglycemia, that's low sugar. So because of the low sugar, they can start having some kind of convulsion. So ensure that child is eating very well. Ensure you're feeding the child. But some of them can even be vomiting as part of the sickness. So just little till the child gets to the hospital. We, the doctors, the pediatrician, we know what we will do for the child. That one is our work. But this one I'm telling you is the basic thing you can do before taking that child to the hospital. Things you should not do for a child that has cholera. Don't come and be giving that child herbal concussion, or go and buy something that they will say will stop stooling. That child the infection will be worsened. That child will have acute kidney injury, what we call kidney damage. And that problem, now you have complicated it, you've made it worse. The infection will spread to the blood from just the intestine to spread to the blood. If you give the child anything that will do diarrhea, boom, or will stop the stooling, don't even try it. Don't starve the child and say, maybe the child is vomiting, it's pulling too much, I should not give the child food. You're going to worsen the sickness. Okay, so don't forget what I told you. Take that child to the hospital. You are not a doctor, you are not a nurse. Even though you are any of them, it's not a condition you manage at home. Please take your child to the hospital. Don't say I did not tell you. Don't say your Pikin-doctor did not give you any tips. Just follow this page, comment, share this video for important tips, so that one or two you can do for your child before you get to the hospital. Don't say I did not help you. 2026 is coming. Follow this page to save yourself from a regret or had I know. Thank you very much.